Hello there. I'm Dr. Hockman. I am the medical matchmaker. I help to match physician-owned practices with physicians where they can really enjoy practicing medicine and enjoy life. And today I am here. I'm so excited to introduce Dr. Kate Mangona of Love Lab MD. Dr. Mangona, go ahead and tell us a little bit about what you do. It's so cool and so unique, and I'm so excited
Yes.
to have
Well,
you.
I love Dr. Hockman, how you introduced yourself as the matchmaker. That is perfect, especially because I'm all about love and matchmaking, you with your spouse again and again and again, and whoever else, you want to be at peace and in love with in your life. I love to talk about relationships. I love to talk about love, marriage. I'm a pediatric radiologist. I practice in Dallas at an academic institution, but I'm married to a physician, so dual physician household. And we have 3 little girls and we have a poodle. We love to dance. We love to invest in real estate. And that being said, like there is a lot going on in my house. I mean, we have crazy, hectic, busy schedules. So I really understand, I can sympathize and empathize with other professional couples who say they don't have time for each other or even for themselves because they have to focus on their career and their kids. And I have a whole bunch to say about that.
I do too, but I'm not the expert. So. Well, that's awesome. And so you have a podcast called Love Lab MD. Your website is Love Lab MD as well, correct?
Yes.
And then you do couples retreats, all the rest. So we'll get to those. But I wanted to ask you a little bit about relationships for physicians. We have this crazy life. A lot of us are charting off to hours. We have it's pretty stressful. How do you find that working as a physician really impacts our relationships with our spouses or even with ourselves?
Yeah, I mean, it's huge. It's huge because as physicians, we have this natural ability to care for people. Like we just have this innate nurturing side of ourselves, and we give more than 100% when we're at work. And oftentimes we think of ourselves last. We don't go pee when we need to go pee. We don't eat when we're hungry. We don't rest when we're fatigued. I mean, if you think about it, we're trained to ignore all of those symptoms, whether you are a surgeon or did, surgery rotation, OB rotation, like you were trained to sit by your pager or sleep with your pager. You're exhausted, but you're going to go slice somebody open, right? That is just the mentality we were told. We had to fix everything. We had to tell people what to do, right? We had to tell like the nurses, maybe the mid-levels, our people below us, what to do and how to get things done, our patients included. And then we come home or we marry somebody or we're in a relationship with somebody and we forget to turn it off or we forget to dial it down. And we're that same AAA type person telling people what to do, trying to fix everything, ignoring our own emotions. And then also thinking that our spouse should maybe ignore their emotions or put those aside because that's what we do. And oftentimes the expectations we have for ourselves, we reflect on other people. So it just is a setup for disaster.
Yeah, no kidding. And I find in relationships we or our spouses, we find that our kids are number one. We need to put our kids first. And I think in part, we have these demanding jobs and then we're putting our kids first. Where does marriage come in there? How do you number one prioritize your number one person, your spouse, after yourself, I guess. And how do you communicate to them? That's what I feel is most important. Let's work on us before we even work on kids.
Yeah. I mean, this is the first key is just being aware that it's an issue. And when you talk to when I talk to other physician moms, other people, maybe just in my social circles around here, even at the hospital, a lot of them don't think it's an issue. Like it clearly is. And you can see it because they wear it on their face, they wear it in their body, you can feel their energy. But they're just like, these are the survival years. You have to get through them. I mean, I'm not super close with my husband, they might say right now, or my wife or my spouse, but it'll all pass, right? Like this is just the hardest time and we just get through it. And this is what we saw our parents do. And this is what my friends are doing. And people just don't realize this doesn't have to be the normal. Like you're allowed to ask for help. You're allowed to take time off for yourselves. You're allowed to ask for things from your boss or for your work, or say if you're your own boss and you have your private practice, you're allowed to implement things in place like your own personal day, your own personal hours, whether it's every day or once a week or however it works out in your life. So awareness is the first step, and just allowing yourself to have that time and that space for you and for your spouse. Because if you don't think it's an issue and you think this is the normal and you feel stuck and you're sad and you start to get angry and resentful, and then it just snowballs until out of control, right? These things don't just happen overnight. They happen very slowly. And then before you know it, your baby is 10 years old, 14 years old, and you don't even know who you are anymore. You don't know who you've married. Like you have completely different interests, which is, different than just having different interests. Naturally, we all do. Opposites attract, but it gets out of control. So having the awareness early on to then focus on this and understand that you actually do have control of your life and you can create the life of your dreams today, that's key.
Yeah. And I was going to focus on a little bit on communication today. And
Mhm.
for anyone watching, this is live, so you should be able to comment, ask Kate, Dr. Mangona questions. And I actually request that you please do, because I wasn't sure if it was working last time. So please just comment and say it's working, and I'll give you a shout out. But I was going to chat a little bit about communication today. What do you find that is the best way for a spouse, a husband or wife?
Mhm.
What's the best way for them to express their emotions and their needs in a way that's safe for them? Like perhaps
Mhm.
they've built this um environment in their relationship that maybe isn't so safe to bring up issues.
Yeah.
What's the best way to bring it up, and in a way that's safe for them and for their partner?
Yeah. So this is a very complex, like it seems like a simple concept, right? But like what you just asked can be very complex, because depending whether you are just married with no kids or you've been married for 10, 20 years, you have kids that are in the house or grown, and there's been years of anger or resentment built up, like those are completely different ends of the spectrum of communication. And then there's the whole in between, right? The whole gray. I mean, you and I know as physicians that most people outside of the doctor world, physician world, think diagnoses are black and white. Like you just go to a doctor and they push a button and out comes your diagnosis and then you treat it, right? That's not how medicine works. Okay. That's not how relationships work either. So you can't just like one day start communicating and then everything turns up roses and rainbows. I always recommend starting with choosing to choosing to first of all understand where your partner is coming from. That means putting on their glasses, their eyeballs, like their lens, which is not at all, like that's just not the human instinct, right? We're thinking of things through our lens, through our childhood, how we grew up, how we went through today. Like we have a terrible day, we get home, our spouse says something, well, we might take that completely a different way than if we're having a wonderful day and our spouse says that same thing. So I just recommend maybe we start with understanding them. And if you don't even understand yourself, or you can't even allow your own self to share your emotions with yourself, maybe you start with you. Okay. And you allow yourself to be angry, be sad, right? Because we can't all be Pollyanna happy all the time. Although I do have a very positive, high energy vibration vibe. I understand you have all the emotions. So I think that answers your question, that there is no right, there's not one way to start. It depends on where you are. And okay, so the first thing I said was can you start to understand where your spouse is coming from? If you're angry at them for saying something, for doing something, can you even begin to understand why they might have said that or done that? And you might not want to at that moment. So maybe it's just not ready to communicate yet about that. And, the second thing is to sometimes talk to somebody who might guide you in a more helpful direction than somebody who won't. And what I mean when I say that is I could easily call my best friend or my mom after I've had a terrible day and I feel like my spouse said something they shouldn't have said, right? We've all done that. You pick up the phone, you'll call your mom, your best friend, and you start complaining or venting. Or people do this. They go type on Facebook. Oh, my spouse just said that, right? I mean, some of those Facebook groups, you see 100 posts a day, right? The husband vents. And I'm sure there's wife vents too. That is not going to lead you in a direction that's healthy and that you probably want to go. Okay, that is not good advice. You're going to want to pick somebody who's going to actually challenge those thoughts that are hurting you and hurting your relationship. And that might not be your best friend. They may be that friend that you're maybe irritated with because they do challenge your thoughts. It might be a coach. It might be a wise coworker who's been there and are on the other side. It may be a relationship coach or therapist. So you have to decide whether you're ready to do it on your own and decide how you're going to show up and decide you're going to begin to want to understand your spouse, or whether you want to reach for help. And that's okay too, because I have like multiple people in my house right now helping me live my life.
Your other people. It's interesting what you said about seeing the other person. I was reading a book. I don't recall which book it was. I think it was a Ryan Holiday book. And he talks about perception and objectivity. He says anything about perception is false. Perception is just a false truth. Objectivity, like no one's actually objective. But if you perceive something.
Yeah, I know the objective is like, how old are you? And,
Right.
Some people are still not going to tell the truth, but like, how old are you? What's the number on the scale? Like, what's your blood pressure? That is the objective. We all know most of the story is all subjective.
Right.
And that has real effects on your body, as a lot of us know, right? And that has huge effects on the way we think.
Yeah, no kidding. So so let's see. If I were having a discussion with my spouse and I say, you always, I know that's a great way to start, right? You always, I don't know, let's pick something stupid. You always paint your face purple, and I really don't like when you paint your face purple. If he were to come back at me and say, I don't paint my face purple. In fact, today I painted my face orange. That may be true. Maybe he painted his face orange.
Yeah.
And not purple. So, okay, more acceptable that it was orange and not purple. But the fact that he defended himself and proved me wrong leaves me feeling alone or isolated or not understood.
Yeah.
Even if I was accusing him of something he didn't do. So,
or did used to do, right? Maybe his face was purple yesterday, right?
Exactly. His face was so purple. But either way.
But you're hitting the nail on the head, Dr. Hochman, because it's really not about the objective things. It's not about what you said and what you did. It's about, okay, how is this making me feel? Thinking about it. How is this making you feel? Is there loss of connection there? It's all the thoughts. It's all the thoughts in the movies we're playing ourselves and what we're making things mean. What does that mean? That you painted your face purple? That you don't love me?
Exactly.
Okay. Yeah. Yes.
I hate the color purple. Purple's the color of my hair. How dare you? How dare you?
And then he denies it, right? they deny it. And then it's like, you're just skimming the surface. Like, these are surface level complaints. And it's like, what's really going on? You have to be that detective. And most of us don't want to be, because we have to be vulnerable.
So how do I, as a spouse, if he were to come to me and say, you, I don't know, let's pick something equally stupid. And obviously these are not stupid things. They can be like really hurtful actual things that like are deep and
Yeah.
cutting. But
Yeah.
I'm obviously picking stupid examples here for
I mean, you
so
could
it's
say
not, but
you always put your work before me.
there you go. You always put your work before me. Okay. He
Mhm.
comes to me and says that. Now,
Yeah.
how do I, in a way that, if I were to say, okay, well, actually, I cut my day off early to be able to come see you.
Mhm.
I
So
I
you're
take
still
less
being defensive.
clients. Exactly.
Yeah.
So, how would I as a spouse and anyone watching somewhat maybe defend yourself, but maybe not defend yourself and kind of portray that I love you. I'm
Mm.
here to support you. Tell me more, kind of activate that active listening while also saying, I love you. I want to just be with you.
I love this question, Dr. Hockman. This is amazing. I feel like this is like I could have told you to ask me this question, but I didn't. This comes directly from John Gottman's work, The Four Horsemen, right? Like the apocalypse of your marriage. It is these four horsemen which will destroy your marriage. And number 2 is defensiveness. Okay. So then you're like, how do I defend myself a little bit, but still show them that I love? No, no, no. There's no defensiveness. That's the thing. If that's your personality type, right? We all have four or five ways we respond to our spouse when it's like not the best ways, right? We can be critical, we could be defensive, we could be contemptuous, where we think of ourselves above them, which a lot of life coachy people do start to do, or therapists do, right? When we're learning, right? This stuff is like, oh no, I have the right answers. So criticism, defensiveness, contempt, or stonewalling, where you're just like silent treatment. And then also there's the martyr. Well, woe is me. I have to kill myself to make this family work, So who do you identify with? Usually you identify with one of those. And I think, Dr. Hockman, you're the defensive. You're the defensive Diana over there. And so if you are defensive, you have to, number one, realize that, recognize that, and then catch yourself in the moment. So when they come and they say, you always put your work before me, you have to stop that knee-jerk reaction to say, well, yeah, but by saying, well, I end my clinic early just so that I can spend time with you, that's still defensiveness, even if it's true that you do enter clinic early. You just stop, you recognize, okay, I could be defensive here, but that would probably be a setup for disaster, right? One more day towards the disaster box. Or you could say, you know what, honey, you're right. I do put my work before you. I trained to be a physician for 10 years. Like, this is what is paying our mortgage. And I understand that, and then however, like, you speak from the heart, but you speak from a place of understanding and curiosity rather than defense. So you have to own that what they're saying is partially true, because you wouldn't get so upset about it if it wasn't partially true. So you just have to own it. Part of what they're saying is right, or it wouldn't like piss you off, and you wouldn't have to get defensive. Because if they said, hey, you put your work before me, and in fact, maybe you're a full-time mom and you're taking care of the house and the kids, maybe you're not putting your work before them, but you're putting the house and the kids before them. I mean, so what I'm trying to say is find the kernel of truth and then agree with them, right? Agree with them. Because not until you agree with them will they see or feel heard. And then feeling heard and understood comes love and connection and bonding.
Okay, I have a follow-up question to that. And I know people watching also do have multiple follow-up questions.
Yes.
And if I'm not seeing any comments, so afterwards we can go back and respond to the comments.
Yeah,
So please,
yeah.
if you're watching, still go ahead and comment or questions.
Oh, Dr. Alexander Stockwell says, sure to be a wonderful conversation. Oh, that was when your post. Okay.
Earlier, right?
Got it.
Okay.
Earlier.
Hi, Dr. Stockwell, if you're watching. love her. So okay, you agree with him. So I agree with him and say, and just so you know, I'm not the I'll get to
You're playing
which
devil's advocate.
henchman
I
I am.
understand. I understand.
Right. I'm not defensive in real life. I'm another really bad one.
Okay. Okay.
um, okay, but so I say, yes, I do put my work in front of you. Okay, maybe in different words. So I'm agreeing with them and they feel heard. And yet now I feel like I'm not being heard and I'm being misunderstood. So how the heck do you what?
Mm.
I'm so
Yeah.
confused here.
So it's not one or the other, though, right? It doesn't have to be one or the other. Just because you're understanding them doesn't mean all of a sudden you're misunderstood. So it will feel different. I will tell you. Once you start doing this, things will start to feel different because they're going to soften, right? From whatever their reaction is. Say you get defensive and then they get critical or they shut down. Well, this change of the dance, I like to talk about the change of the dance, whereas instead of getting defensive, you get curious and understanding. They're not going to have the pattern has been broken. They're not going to have that ammo to keep going and then fight back. They're going to be like, what? Oh my gosh, she's agreeing with me. Okay, so then they're going to soften and the conversation is just going to go differently. And then you're welcome to figure out whether it's time for you to share your emotions or not. It might not need to happen in that one conversation. Here's the other thing. Us physicians, women physicians especially, we feel like things need to happen like they need to happen now. Like, why put off tomorrow what we can do today, right? Let's do it all today. Communication doesn't work like that. Relationships doesn't work like that. Relationships is putting forth like a continuous stream, ups and downs, and it can be a roller coaster of love and understanding and acceptance. So then you have to figure out, why am I feeling misunderstood here? Is it because they think I'm at work and I'm not with them? Like, where is that coming from? And is that something you need to think about internally, self-reflect? Or is it something is it going to be helpful to move forward and discuss that right then and there? And that's up to you, right? Because if there's, I also talk about, okay, I'm just going to interject the triad, the communication triad. Okay. And the number one on the communication, there's three things to every good conversation, like a win-win conversation. And the number one is you have to have like a common goal in order to even start a conversation. And this is true with your spouse, with your coworker, your child. Like, if you can't figure out a common goal of where that conversation is going to lead you, then you don't need to bring it up, right? If you're and so like if you are feeling misunderstood, the whole point of that conversation is that for you to feel understood or for you both to feel understood, right? Because it's a completely different angle. And if it's just for you to feel understood, you can go do that on your own. But if it's a mutual, okay, we're in a relationship, we're human beings, we're species, this is like who we are, we connect with one another and love one another, procreate, then it's got to be a mutual common goal that you can think of before you move to number two.
Mm-hmm.
What do you think? What are you feeling?
Love it. Love it. Taking notes here.
Good.
Like that nerdy kid. Tell me more. Okay, let's get to stonewalling. That is my embarrassing
Okay. You shut
thing for
down.
today. This is
Silent
what I
treatment.
do. I shut down. I get so hurt. I just close into myself.
Mm-hmm.
Nobody can get through my big stone wall.
Mm-hmm.
I don't want to be that way. But as the stonewaller and the stonewallee, what can you do or do to help? Oh, look. There you go. I
That's
have
so
some.
fun.
If it does that, I bet it also does something else. Anyway, as the stonewallee and the stonewaller, what can you do to get yourself or help to get your spouse out of the stonewalling?
Yeah. No, this is interesting because I actually used to be a stonewaller. the first couple of years of my marriage. We've been married for 10 years now. And I've learned that that was not a pattern that I wanted to continue because it would just drive my husband even more angry. Right. And I was like, well, with my parents, it worked because my mom would shut down and then my dad would understand and go after her. Nope, didn't happen in my marriage. Like, we're all different. I would shut down and then he would even get more angry. So it didn't work. But I will say, if you read John Gottman's material, more than a higher percentage of men are actually stonewallers.
Huh.
I didn't realize this because I come from a family of women who stonewall. But yeah, it's like higher for the men to stonewall in heterosexual relationships. So the key, or the antidote, if you will, for stonewalling is to figure out a way that you can physiologically self-soothe your nervous system, your body, because you're stonewalling because you no longer feel safe. Okay. It's that fight, flight, freeze, or fawn, and you don't feel safe to share your own emotions, to share your story. Like, all you see is destruction ahead. So you're just going to bottle it up, or you don't know how to process your emotions, or you may not want to. So, and it's really not up to your spouse to figure that out because they don't live inside your head. They can't. And there's as a stonewaller, Dr. Hockman, there's a whole lot of stuff going on in your brain. You're not just being silent, right? You're like, oh, I wish he would come after, and I wish he would say this, and he should have done, it's like the ruminating, right? It's the constant rumination that fuels the continuous stonewalling. And with that rumination, you're never going to calm that amygdala down, right? That the hindbrain, is that your hindbrain, like the old part of your brain that's like firing off all those primal emotions. So it is up to you to find techniques that work for you. And there's thousands of them. Some people will go outside for a walk. Some people will go for a drive. Some people will call their best friend and just have her talk. Hey, tell me about your day. Okay. Some people will paint, will throw themselves into some sort of art form. Some people are going to go to martial arts or play tennis. And then there are those of us who are like, well, no, I need something quicker. Like, I can't I'm at work, or I'm in my office and I'm taking care of my baby. So maybe you need to start something like tapping. Maybe you're going to just start tapping, and there's a whole podcast on how to tap. Or maybe you do the 5 senses. You become mindful. What do you smell? What can you hear? What do you see? What do you feel? And you just start feeling your skin, or you just become mindful in that moment. And it takes practice. Not all these things you're going to do once and you're going to figure out, or maybe I just pick up my dog, sitting in the corner over there, my poodle. But the key is to not think about what caused you to stonewall in the first place, or what you think caused you to stonewall, right? We all know, or
It all goes back to our childhood, right?
Yeah. Yeah. And when you're stonewalling because of a story you're telling yourself about something somebody did or said. Okay, so stop thinking about what they said. Stop. Okay, put it away. You don't have to deny it or repress it or suppress it. It still exists. It's still there, but you're just not in a good place to think about that right now.
You know what I love about this so much is that it's like, this is all you. Just suck it up, Buttercup. I love it. Okay, maybe not suck it up, Buttercup. That's the complete opposite. But I love it. This is not your partner's mess to fix.
Yes.
This is your mess to fix.
You're in control. You are in control.
Something happened. You may have been wronged. You may not have been wronged because, perception. But, not his monkey, not his or her or their, not their circus, not their monkeys. This is your issue that you need to fix.
Not their monkeys. I love that. And here's the thing. If you're in the right relationship, you'll be able to work through it and take control of the situation yourself. And if you're not in the right relationship, you'll figure it out too.
Yeah. I concur. Love it. Okay, well, I could ask you questions forever, but I'm going to respect your time. And tell us a little bit about where people can find you, some of the cool things you're doing, and how we all can join.
Absolutely. So follow me on Instagram. That's my number one ask. Go follow me on Instagram. It's my name, Kate Mangona, MD. I post funny reels about my family, kids, marriage, sometimes radiology, but not as much. And you could listen to my podcast, Love Lab MD, my website, as Dr. Hockman mentioned, lovelabmd.com. And my new thing, the new wave for the Love Lab MD coaching is retreats. That is my new love, my new passion. So and we mentioned Dr. Alexandra Stockwell, who's my business partner. We're hosting our first intimacy retreat together in Maui. It's sold out. So if you're wanting to come on a retreat with us in the future, we're in the process of planning 3 more for 2025 and 1 in 2026. Different tiers, levels, some luxury, some I guess you would say more normal. I don't even know what you call it. Power Couples Getaway is under process right now. So you can find out more if you just follow me on Instagram, because I'll tell you guys on there. If you want to get on the wait list, though, go to my partner's website right now, alexandrastockwell.com/honeymoon. And there you'll get on our wait list, because Honeymoon 2.0 in Maui next month is sold out.
It's going to be amazing. All
Thank
right. Well,
you.
cool. I know it's very cool. I took a look and I'm like, oh my gosh, looks amazing. And I was listening to your podcast this morning while I was walking my dog. And
Which
it was
episode?
so
Do you
good. It
remember
was
what?
about parenting with
Okay.
different parenting styles.
Okay.
I'm fortunate that we have a very similar parenting style, but I
Good.
liked a lot, even still, I liked a lot of the things you said in there, because,
Yes.
we still come from different backgrounds and thought processes. And, I'm a stonewaller.
Oh, I
So
love
there you go.
parenting. I mean, I
It
have
was so
2 parenting coaches, so.
Anyway, listening to your but yes, I looked into it a little while ago and it looked incredible, all the different things we'll be doing. So I'm going to keep my eyes open and I'm going to join the wait list for the Dallas, Texas one. So please,
Yes.
everyone in Texas, come join me if I can convince my hubby, because I'm part of a power couple too. So
Yes, exactly. And that's the thing. Like, these retreats are typically for power couples who feel maybe a little bit stuck, or like in the grind, and they want to really work on intimacy and communication at a whole different level, which just explodes your life with possibilities and joy. And who doesn't want more joy?
exactly. Well, thank you so much for joining us.
Thanks for having me.
Go check out Dr. Kate Mangona on lovelabmd.com. And as a reminder, I am the medical matchmaker. I love matching physicians with private practices, not with other physicians. And that is Dr. Mangona's, you nurture what's already there. So we need to there's a physician out there that does physician matchmaking.
Mm-hmm.
All right. Well, it was so nice having you. Thank you so much.
Thank you. Bye, doctor.